Good morning. I've been asked actually by many patients for snippets of information. This morning we will actually talk about diet in ME CFS. I'm asked actually for specific ideas on diet. Well, simply there is no simple diet or no overwhelming diet that is used by the majority of patients. Each patient actually uses their own discretion as what they can eat. It's important, obviously, to eat a diet that is good for one's system. The particular system that we want to actually support, of course, is the immune system, which we believe is dysfunctional in ME/CFS. Many years ago, a substance called cutepressine was used as an injection supplement in treatment. This contained multiple amino acids, and it was shown later that these amino acids were necessary for the methylation cycle in the immune system, where we believe actually the dysfunction lies. So, a diet plentiful in amino acids would be appropriate. Other substances that are important are trace metals. Certain trace metals are seen in the methylation cycle: zinc, selenium, molybdenum. These actually would be helpful if they were added in small amounts to the diet. It is important actually to have a diet plentiful in protein and amino acids, as I've said before. We believe that magnesium is helpful in also the maintenance of muscle function, as well as the methylation cycle. The methylation cycle basically produces glutathione. Unfortunately, if we actually take glutathione as a part of our diet, it is very poorly absorbed. So this would be obviously ideal because the glutathione is the byproduct of the methylation cycle. It is important actually to have a proper ratio of sodium, potassium, calcium, and magnesium. And Bassi in Spain many years ago showed that these electrolytes were important and should be kept in the correct ratio. Blood pressure is usually low in patients with ME/CFS. Addition of sodium in the form of sodium chloride, common salt, may actually be appropriate to supplement the blood pressure. Some patients actually try to increase the blood pressure by taking licorice root. The problem actually with that is potassium levels actually decline on taking actually licorice. So if you are going to actually take licorice or licorice root, it is important to maintain a potassium, and the potassium actually can be taken in the form of an electrolyte mix. The usual electrolyte mix actually that is looked at is Gatorade. We actually do not recommend Gatorade because it contains sugar. We want to actually have an electrolyte mix that is sugar-free. Other substances that have been actually used in the past are substances that try to actually improve the immune system. There is no universal substance that improves the immune system. We find that the vitamin B complex, vitamins B1, B6, B12, are important, and they are integral in the methylation cycle. The type of B12 that is used is either cyanocobalamin, which is common B12, hydroxy B12, which was suggested by my late friend and colleague Van Koninberg, or methylcobalamin, which is the type of B12 that we prefer, methyl B12. We hope actually that some of these pointers have been helpful, and we look forward to helping you as much as we can with these little snippets. Good morning. Keep well.